Hello, my name is Tiandra Thompson, and I am doing prevention. So, I'm doing prevention of substance use among individuals with co-occurring disorders. Why prevention is important? Prevention is important because individuals living with mental health challenges are at a significantly higher risk of developing substance use disorders, often using substances as a way to cope with distress, trauma, or unresolved emotional pain. Prevention is critical because it shifts the focus from crisis response to early intervention. By teaching healthier coping mechanisms and increasing awareness of mental health needs, prevention efforts can reduce reliance on substances and promote overall healing. There are many unique challenges in mental health and substance abuse that are co occurring disorders. And those are things, for instance, like mental health symptoms may go untreated if you don't treat both. Stigma prevents people from seeking help, and prevention must address both mental health needs and also substance use disorder. Targeted prevention programs. So, although programs do exist, there are not many that are designed to meet the needs of both substance use and mental health disorders. Traditional programs, they usually focus on one or the other. And so, without addressing mental health, it limits their effectiveness. To improve outcomes, there needs to be more programs that cover both. So, right now, the prevention programs must be specifically tailored to include mental health educational, emotional regulation strategies, and trauma informed approaches that reflect the lived experiences of this population. And right now, those programs are far and few in between. So, more programs like this to address both need to be developed. An integrated approach to prevention recognizes that mental health and substance use are both deeply connected and should not be treated as separate issues. Addressing both conditions simultaneously allows for more comprehensive care and better outcomes. This approach ensures that individuals receive coordinated support that targets the root causes of substance abuse rather than only addressing the symptoms. So, one example of an integrated program in Louisville is UofL's Health Peace Hospital Adult Outpatient Center. The program is known for treating both mental health disorders and substance use at the same time, which is often called co-occurring or dual diagnosis, exactly what we're talking about. They offer services like intensive outpatient programs, which is IOP, and partial hospitalization programs is called PHP. This is where individuals attend therapy several times a week while still living at home. What makes the program integrated is that clients don't have to go to separate places for mental health and addiction. They receive group therapy, individual counseling, and specialized support for both issues in one setting. Another strong example is the Louisville Addiction Center. It focuses on a trauma informed integrated approach. This program recognizes that many people struggling with addiction also have underlying mental health issues like depression, anxiety, or past trauma. Instead of treating just the addiction, they combine therapies such as individual counseling, psychiatric care, and skill building to help the emotional regulation and coping. Their approach is holistic, meaning they look at the whole person and not just the substance use. This kind of integrated care helps reduce relapse because it addresses the root causes behind addiction. A third one in Louisville is Baptist Health Intensive Outpatient Program. It offers both mental health and substance use services together. The program includes group therapy, individual counseling, medication management, and education about coping skills. They also provide family support and they even have a 12-step meeting as part of the treatment. What stands out is that they create a structured but flexible environment where people can continue working or taking care of responsibilities while getting help. This integrated model supports long term recovery by teaching practical life skills, along with addressing both mental health and addiction issues at the same time. These programs show how Louisville has multiple treatment options that use an integrated approach. Instead of separating mental health and substance abuse, these programs combine services to treat the whole person. This approach is important because many individuals experience both conditions together, and treating them at the same time leads to better outcomes, stronger coping skills, and a lower chance of relapse. Early screening plays a vital role in prevention by identifying mental health concerns and substance use risk factors before they escalate into more serious problems. Schools, healthcare providers, and community organizations are in a unique position to detect early warning signs and connect individuals with appropriate services. Timely intervention can reduce the severity of both mental health and substance use issues and improve long term recovery outcomes. Teaching healthy coping skills is essential in preventing substance use among individuals with co occurring disorders. Skills such as mindfulness, emotional regulation, and problem solving can help individuals manage stress and difficult emotions without turning to substances. Encouraging self awareness and providing therapeutic support can empower individuals to develop healthier responses to life's challenges. This is just an example of meditation and a way to be mindful and just a practice that would help with co occurring disorders. Trauma informed care. Trauma informed care is a critical component of prevention because many individuals with co occurring disorders have experienced significant trauma. This approach emphasizes safety, trust, and empowerment while recognizing the impact of past experiences on current behaviors. By creating supportive and non judgmental environments, providers can help individuals feel secure enough to engage in prevention and treatment efforts. I think this is the most important of them all, is to have support systems. Strong support systems play a crucial role in preventing substance use by reducing isolation and promoting connection. Family members, peers, and community networks can provide encouragement, accountability, and emotional support. When individuals feel connected and supported, they are less likely to rely on substances as a coping mechanism. And this is what a family looks like that would surround a person who is struggling with mental health issues and substance use issues. When a person gets love and feels loved, it may be a little easier for them to face what they're already dealing with the mental health issues and with substance abuse issues. Cultural awareness. Prevention must respect cultural differences. Programs should be flexible and inclusive. Individuals' needs should be considered on a one on one basis. The future of prevention. The future of prevention requires a shift toward more personalized and holistic approaches. Ones that integrate mental health into all substance use prevention efforts. Expanding access to services, improving program design, and addressing systematic barriers will be essential. A focus on person centered care can lead to more effective and sustainable prevention outcomes. So, in summary, prevention is the most effective when it addresses the whole person rather than focusing on a single issue. By recognizing the connection between mental health and substance use, providing early support, and promoting healthy coping strategies, prevention efforts can make a meaningful difference in individuals' lives and long term well being. Here's the list of references that I use to come up with information about co occurring disorders.